busy. So
Yeah. So,
thank you for joining. And again, it's good to check in and talk, and we want to keep it brief because I know you guys have busy days and need to get back to work. So we're doing another like presentation slash Mentimeter. So if you have your phone available, you can go to a website and then just type in the number or scan a QR code. Let me actually see if no, I have enabled the QR code. So let me share my screen. And today we will be then talking about health promotion and outreach. Um, oops. Okay, just need to make it bigger. There we go. Can everyone see the screen after our updates? And feel free to unmute. This can be a conversation, but basically with your phone you can just
Yes, you can see the screen.
okay, great. Thanks, Rexon. So with your phone camera you can scan and then you have it available, or you see on the top the number. So you can go on to the internet and just type menti.com and then put in the number. And I see at the bottom two people joined so far. I'm one of them. So I'll still give it some time.
I am the next person to join.
Ah, okay, great. Oh, one more.
Mm-hmm.
I just joined in.
Oh, nice.
Perfect. Thanks. So it's me, Verlina, and Rennie so far. Does anyone have issues with this? Or is there a question?
There's Monica. Are you getting through?
So let me do this. I will also put the link into the group. Where is the ultrasound group? So I put the link into the ultrasound group. That might be even easier. Yes, I see we have 4 people. Let's go. We're a total of 11 participants today, so we're still missing a couple more people.
Nurse Monica, are you getting through? You're muted. I'm not hearing you.
I see it on the screen.
Did you join Mentimeter on your phone?
Join where?
You see on the WhatsApp group the link we sent. So if you can click on the link. I'm here. I see someone from Guns and Tuitioning also joined. Brian, were oh 6 people. Good. Marissa.
Marissa's from Icenero.
Oh, and one like. Thank you. Okay. 3 likes. Even better. Okay, let's start.
Yeah.
So today we want to talk a little bit about outreach and health promotion. And before we start, what is an outreach? So again, in bullet points, and we can send it afterwards. But it's about sharing important health information with your community. So anything that can be effective to the community. It might be infectious disease related or STI prevention. So different medical topics that impact the community, and you transfer this information to your community coming out of the medical field. And then also, sorry?
I was just gonna say, we know that you guys practice this often with your home visits and kind of going out of the health center and spreading this information to encourage more patients to come get checkups and whatnot. Janna's right, it can be a wide variety of topics.
Exactly. And it's also to make people aware of the medical services that are available, also especially within the community. You know, it can be like testing for malaria or dengue. It can also be about, you know, what do you call it in English? Like sex prevention, the baby pill. I don't know what
Contraceptive,
contraceptive. That's the term. Thanks.
Family
Uh,
planning.
family planning, yes.
family planning. Thank you. In German, it's called anti-baby pill. That's why confused. And then, yeah, just connect people to this. So on your phone, you will see the question, and then there is a way to answer it. So I was just wondering, from your perspective and your knowledge, what is the most common way people in your village hear news? So if something new happens, how does it make the round? So on your phone, you see the same question and you can type an answer. And then here at the bottom, I can see 1 out of 8 persons has responded. Interesting, mobile radio.
WhatsApp and posters.
Okay, we'll give it another couple of seconds and then move on. Does anyone have issue? Okay, phone call.
Can anyone elaborate on social media? Is that often things that you're reposting, or are you creating flyers to put on social media to spread news? What does that look like?
Small gossips. Rennie, was that you?
Oh, Janna, you know me so well.
I'm curious, persons that said mobile radio. Can someone elaborate this maybe?
Oh, barely know.
Hmm.
Rennie, you know me very well. Yes, yeah, now in the village we have mobile radios, so whenever we have like message coming into the village, like for example, people coming out from Georgetown or medical team coming out, they would call through the mobile radio and they would inform the villagers or the people in the village.
Mm. I
It's like,
remember actually seeing you on an
yeah,
ATV with the mobile phone.
yeah.
And I
Oh,
remember in Parima, you guys also have the village speakers. I remember hearing everyone come to the football practice. The women's are playing. So
nice.
Yes, yeah, no, see.
I
Yes.
remember that. Okay, great. Love it. So I see a lot of social media. And here are a couple of things I just wrote down different ways. You know, there are common ways, less common, but what Reilly mentioned, house-to-house visit, especially for less mobile villagers, local radio spots. What do you guys have in Parima? Facebook. So lots of different ways. There's not one way to translate communication. It can even be gossip, right? What Rennie said. So different options. And again, since you see it on your phone, feel free to take a screenshot, but I can also send those details out later. Okay, so now on your phone, I want to know from you, what is the value of health promotion?
Nice.
We can give it another minute. It can be one word, it can be two words, but just something that comes to your mind. Oops. Sorry about that.
Nice.
Does anyone want to elaborate on their answer or in general? What do you think, Rennie?
I was just about to answer with the health, with the disease prevention. I actually put that one. Important value of health promotion is as long as you promote good or healthy health habits, it can prevent a lot of disease in your communities, especially if it's about hygiene. It's about, in this case, it's about ultrasound, so you can prevent, complications in the long run for your mothers. So yeah, it's all the responses are correct. Just wanted to give it a bit on disease prevention.
Mm-hmm. Does any of you have an example of like a successful health promotion that happened in the community and where you saw one of these values coming in?
Yana, have you seen any or any when you guys have been visiting the communities?
I was thinking back even from further with COVID, you know, like the value there was, of course, like making sure others don't get sick. And then part of the health promotion was seeing a lot of advertisements for masks and how to wash your hands properly and having all these posters. So that's something like we have seen all over the world, like a large scale health promotion, but then on a small scale. Um, a lot in the communities, like different posters or images. I've seen what we had earlier on the slides. So,
That has me thinking, I remember in COVID too, there were posters at health hubs, but also that was a time when there was a lot of health promotion outside of hospitals or clinics. Like I remember seeing posters at other community gathering places like schools or stores or things to reach people where they're frequently visiting.
yeah, location is important. Where do you reach the people and what population are you trying to reach, right?
Mm.
Okay, let's move on to the next question. Oh, just quickly elaborating. Is to raise awareness about available services. So in this case, about ultrasound. We have been talking a lot about how it works and training you guys. And I think today is mainly to teach you how can you translate what you have learned into the service you are now able to provide to your community and how you can make sure that they are aware of the services. Because sometimes when we're into a topic and we're very deeply involved, that's all we can think about. But then to someone on the outside, it's the last thing they might be thinking about. You know, like why should someone come and do an ultrasound if that's something they would usually not do? But then there is you now who has trained in using ultrasound and done all these like questionnaires and lessons. So how can we make sure everyone is aware of it? And then, you know, the value is also to build trust in the system. And I know that's something that can come up, especially in the hinterlands where people, you know, might have a couple of questions or they're not sure about the technology or they're not aware, like, is an ultrasound safe? Is something going to happen or not? So the value lies also in educating and making sure they can trust the service and that they can trust the healthcare outcome.
You become an ambassador for it.
I like that. You're an health ambassador. So that's where you as a health worker come in, right? You're the bridge between the patient and the healthcare system. And especially in Guyana, where it's so hard sometimes to reach certain communities. And we've been there, right? You need to take boats, ATVs, and planes. You're the closest point of contact, or what we like to call the hand and the heart, to the patient. So that's where you're the ambassador. And, you know, also you're at a cross point between all this medical information, but also being in the community context that you can make sure that it goes both ways. What are you experiencing in the community and how can you maybe translate it to the ministry or to your RHO? You can see a rise of certain diseases or certain health habits that you want to prevent, but also it goes the other way around. The ministry is coming up with vouchers or new services, and how can you make sure people are aware of it? And then, you know, the local context. Earlier, you said social media, radio. Every community has a different setup and a different way of reaching people. So you're the best at knowing the methods, right? Like, is it a poster? Is it hanging up something at church? Is it mentioning at church? Is it through WhatsApp stories? I know a lot of you guys are active on WhatsApp. So, you know, there are different ways of how you can make sure the community listens and also take in feedback. We'll stop here for now. We have a couple more slides coming, but now I would like to hear from you. We can continue, but I will just stop sharing for now and just open up the conversation. And we have 12 people, so
Did any of those methods resonate with you guys, or do you have any ideas for what would be the best methods within your context to communicate about this service to people in the community?
Any ideas whatsoever what you can do in your community, like within the next couple of days or weeks, about health promotion when it comes to the ultrasound? Apart from the ideas that we already pitched with the different methods of communication, do you have any other ideas or any other ways or methods you can use in your community to promote? And let's hear from Verlene, and then we'll come to Monica.
All right, good afternoon again. I think the way we could is during the public meetings. That's where we would raise more. Well, we would tell the people more about the ultrasound, and well, people get to know that we're doing ultrasound along with doctor. So I think the best thing is like in a meeting, a general meeting where people would come to the meeting.
Like with the village council and so on. Okay.
You could bring the probe to the meeting to show people what it looks like even. If they want to pass it around or just understand what it looks like a little more.
I think there are some influencers in Parimo that you could also ask. A colleague is one, and there's also this other guy, I don't remember his name, but he's very active on TikTok and I think Facebook.
Oh, well, Galina, she's on training right now, so maybe we would use Chris
Chris,
Elliman, you're talking about.
yeah, he's very active in the ICT hub, and he has a very wide audience, international audience. So there's just an idea you can make use of, your
Social media.
colleagues and community members that are social media active.
Rennie, I remember you saying last week too that with the ultrasound you can do gender reveal party
Yep.
now. I know a lot of people make videos on that, and so could use the ultrasound to do a gender reveal video.
Yeah. You can always ask the doctor to tell you later on WhatsApp the gender so the parents don't know, and then you can help them create an envelope or something. So that's one method. I think is it Nurse Monica and Karawap? You also didn't wanted to say something.
Yes. Good afternoon. For the message, right, to go through. First of all, we can let it go to the clinics, infant clinic, antenatal clinic. We can pass it through PTA meetings, the village meetings, and on home visiting we go, we tell people, and on WhatsApp.
That's
Love
helpful.
it. More than one idea.
Yeah.
It's good. Multiple channels.
And for example, what I always love to think is to start early. Even invite some school children, teach them about medical devices. What is each device for? That could be also very interesting. No, I love all the different ideas, and thank you for sharing, Nurse Monica and Verlina. That's really helpful. So let me just share back my screen, and then I think it just continues on the phones automatically. Yes. Okay. So now a couple of questions. Now imagine you have the ultrasound and you can start using the services whenever you need them. My question is here, how much time can the patient or, for example, an antenatal mother save by not having to go all the way to Bartica, to Lethem, to Linden? So by being able to do it in the community. You can think about it, just put a number. We're just curious to hear about it. Oh wow, 12 hours, 2 days. Still waiting for a couple more answers. There we go. 1 day. When someone says 2 times, what do they mean?
For me, I think the first admission we would do an ultrasound and maybe at 36 weeks, 37 another ultrasound for me. if I'm right.
Oh, two scans throughout the pregnancy? Is that
Yeah.
okay?
Gotcha. Yeah, and the good thing is that you can do it even more often, right? Whenever they want to check, you could do it each trimester. If they, I don't know, send something, if you know they're close to the due date. So that's a nice thing. You can do it as much and as many times as the patient wants to or needs to. Okay, I'll give
Yeah.
a couple more seconds. Any more comments?
And also, I was just saying to if the mother is getting problem with her baby's heartbeat or whatever, maybe then we could do it too.
Exactly.
Definitely.
Typically should be 2 to 3 times during pregnancy, but it can be more, depends on the patient's condition or the fetal condition that you initially found from the first. Probably there's other complications that, like health complications for the mommy. You can use your own assessment to determine how many ultrasound you might actually need. But typically it should be 2 to 3 times during the pregnancy.
Mm-hmm. And again, with the ultrasound, you can take images. So if they're further along and you can see the baby a bit better, you can actually see a little bit of the face, the profile or whatnot. You can always take images and send it then to the patient so they have it on their phone as well.
I think with just to add, patients who can do more than one ultrasound will be patients with high risk for high risk pregnancies, multiple fetus, if it's a twin, triplet, concerns about the growth of the fetus. If you encounter any placental issues, those are some ways you could increase the amount of ultrasound monitoring for your mommies. Just some additional information.
And maybe since we have the same question, I'm also curious how many pregnant mothers you have in your community. So maybe you can just say like your community and then a number. Like I put an example,
2,000.
I don't know. Ah, Rennie.
Eight mothers.
Who's 8 mothers? Verlina.
Yes, I have 8 mothers.
That's
Wow.
a lot of mothers you have.
That's a lot of ultrasound scans we'll need.
It's
For
20,
And
you.
I
that's 24 ultrasounds.
get
Oh
eight
my
mothers
goodness.
here. I used to get before like 3 mothers, 4 was the most. But like this year, I get 8 mothers.
Oh my goodness.
Verlina, is it this year alone you became a midwife or early part?
I didn't get you, Rennie.
Was it this year that you became a midwife officially? You mute yourself.
Last year,
Oh,
officially.
okay. You're
20.
probably
Yeah.
probably
Wow.
20 in Philippi, Rexon. You're not doing family planning with your mommies?
Rennie, I
No,
think
Rene.
if
Rene,
the grandmothers hear about, so they're multiplying more.
Yeah, and you probably
yeah,
heard.
PPP sending cash grant for babies, so they're just
Oh
increasing the
yeah.
population.
You
Oh
heard it,
my
Janna?
What's that?
The
They're sending us
government
cash grants
the
per baby.
government gives 100,000, that's 500 US for every baby that every birth, every
Is that
baby.
recent?
Yeah.
So we'll need a lot of ultrasound scans to make sure they're healthy.
You guys got some fertile
for
Oh.
the people. Yeah.
Mm.
This scenario has 10.
So everybody has multiple.
Amazing. So we can expect a lot of ultrasound calls and lots of ultrasound images. Thanks for sharing. Who said here 3 mothers? I don't see a community name. Just to be.
That might be gone. I have feelings it's gone.
Yeah, do we have Brian here?
Yeah.
Was it you, Brian?
Yes, it's gone.
I,
It's true.
I just had a feeling.
Rennie, you know them so well. Okay, thanks for sharing, everyone. And now, going back to the cash grants, I'm wondering how much money does the patient save or the antenatal mothers? And you can consider the transportation, like taking a boat or taking a plane or ATV, and then also the time. Time is money. Like, how much money does someone save by not having to go to the hospital to do an ultrasound scan? Oh wow, that's around $100 in Varuni, 20,000. Who was it? Kayla, was it you who said those? 20?
Yes, John, I did. Good afternoon.
Hi, good afternoon. Can you elaborate, like, from Viruni? I mean, we talked, so I know, but to the others, like, what's the step? Like, how do they get to the hospital? Is it Linden?
So one way will be it's to New Amsterdam, one will be $8,000 with passenger boat. That's the goal. So it will be $16,000 and then the person have to eat, then they will have to take a car. So a rough average would be 20,000.
Hmm. Oh, that's a lot. I see someone else also said 20. Who said 200,000?
Gone.
Uh,
Gone.
Just know it's gone. They're so far. Like they're like literally the end of the map.
Yeah, yeah, there is 1 week.
One
one
way.
way.
And how often do you have to send patients to pay that?
I think just recently you had to send a patient, so let them. Or did you get to send a patient out via Medivac or the patient with the fetal demise?
I was to send out to GPHC, but it eventually everything happened for good. So the patient didn't bother. I think to
So
go.
she expelled the fetus right at Gons.
Yes.
Oh, okay.
Also, thanks for the ultrasound because it was confirmed that everything was nothing.
Yeah, it was sad, but
Yeah.
so
Hmm. What was the case, Rennie? The baby was like a stillbirth?
yeah, died inside of her, so
Hmm.
it had to be aborted. I think
Sorry.
it happened on a Saturday or it was on a Monday. She came to the health post on a Saturday. I think it was like a week. And I think Brian has more of the information. I can't remember everything exactly. It was a few days after she went to the health post.
Mm-hmm. I'm sorry to hear that, but I'm happy you could help Brian.
Yeah.
Correct. So now adding meals and transportation.
Okay, but this is quite impressive, and thanks for sharing, everyone, because Well, we talked about non-monetary value, but of course, money matters at the end of the day as well, especially we know that in the healthcare sector. So you can imagine now that you're able to use the ultrasound in your community, how much you can help also on the monetary part to your patients and to the mothers. It does take away. All right.
Completely.
Okay, let's move on to the next one. So we're just wondering if someone in your community doesn't read that well or has maybe difficulties even hearing, but what are more like accessible ways of doing community outreach? I know we talked a lot about social media posts, posters. Okay, let's give it another minute. Okay, not much on this one. That's fine. Let Oh, there we go. Now it's coming in house to house visit. Mm, I like this, a clock symbol. So indicate also what time the clinic's hours are. Mm-hmm. Exactly how it looks like. I can imagine maybe there are some misconceptions of ultrasound because there are different types of ultrasound, but to show them it's a super small device, it goes in your belly.
Yeah,
Great.
this is great. I love that.
Yeah. Okay, I think we're towards the end. We have a couple more slides, but I was just wondering, what are the challenges doing outreach? I see transportation, difficult to reach people who live far away.
Anyone have any issues with like language barrier?
I would say I have an issue, but I have one person that um sometimes I don't really understand. Um, but I try to break it down as simple as I can for them.
Mm-hmm.
A little mental issue. So that's about it.
Okay.
Mm-hmm. So how do you explain it? Like how would you, for example, explain the ultrasound service?
So I'll show them pictures. Sometimes if people can't understand, I'll show them pictures, and by showing them pictures, they would understand better.
Hmm. So going visual, I like the idea. I was wondering, in Purima, you guys are pretty multilingual, no? Like, I keep mixing up, but is it Aracuna or Akawayo?
It's Arikuna.
Aracuna, but also Spanish and Portuguese sometimes even. People
Spanish.
Spanish, right? Have you run into language barrier issues or that language was an issue?
Maybe when some coming like from below, like other villages who speak Akawayo, then maybe some, it would be not exactly like Arikuna, but we sometimes get the
Mm-hmm.
Spanish also with some of this with us here at the health post.
I see. Oh, you speak Spanish, right? I remember hearing a couple of words.
Yeah, I do.
Nice. Amazing. Thanks for sharing. Okay, before we end, part of, well, we're not going to do an assessment. We want to see it in practice. So Reilly went ahead and she made an ultrasound promotion poster at home. And this is just an idea, but you can see how she highlighted ultrasound. So it catches people's attention. She underlined the important parts, even an image, what Kayla was saying, and you, Berlina, to have an image. Maybe you can like promote it in different ways. So I want to ask everyone as part of the ultrasound training and this assignment to create an ultrasound poster. But now that we also talked about different methods, feel free to come up with a creative other way. If you want to record a radio announcement you're making or record yourself during a village announcement, share with us how are you promoting the ultrasound services to your community and just send them to the group or send them to us privately. But we will love to see and hear how you are going ahead now and sharing these services. I was also just thinking you guys in the first lecture learned so much about how an ultrasound works. You can even go to a school and make a whole science lesson out of it. It's super interesting how the sound waves translate into images that can tell you then if you're going to have a boy or a girl. I am pretty sure kids would love to learn about it.
It'd
But
be
anyway,
great. Yeah. No, I was just saying, we'd love to see all of this if you can send the outreach methods you're using in the WhatsApp group too. We'd love to see the posters you make or a video that you're putting on the radio or a WhatsApp flyer. But please send them in the group so that we can see what's working and encourage other people. But yeah, I like that idea with the going to the schools too.
Okay.
I can't get the image out of my head with the features you draw on the poster, Reilly.
Very well done.
Cute. it's really cute.
Oh, thanks.
You know, you could even go to your village shop and explain to them, you know, if people want to do gender reveal parties, they can come to the health post to get the gender of the baby, and then the village shop can maybe help like with the envelope setup or whatnot. Or, you know, there's so many ways of how you can do health promotion, and a lot of them you have already been doing. So now it's just about how can you do the ultrasound health promotion to the communities, because we know you have a lot of pregnant mummies. So to see how they can come and get their ultrasound done. And if there are gender reveal parties, please take pictures, please take videos. We would love to see that.
Yeah, any content you have, send in the chat.
And yeah, let's encourage each other, because we just wanted to touch base on it. But again, we're here working on, you know, the telemedicine aspect, but you're actually in the field working with the people and you are the health workers. So that's why I also love talking today, because we got to learn a lot from you. And I want to continue this conversation so that you can continue talking to one another, showing different creative ways. But yeah, thank you so much, everyone, for joining. I was hoping we don't take this much time out of the day, but I really enjoyed our conversations and we got to learn quite a bit today. So I'll send the slides, and yeah, just want to start encouraging people to send out the posters and the different ways you do health promotion. And then things starting next week or the week after, we'll get some more details, but then we'll go into the practice sessions where we will just do practice scans and assessments, and Dr. McDavid will just be working with you on doing those assessments. So then actually getting to the point of doing ultrasound scans. But yeah, those were all the lessons so far. Thanks, everyone. I hope you have a good day.
Thank you so much.